Everybody, it's Cheyenne and welcome back to my channel. Today's video is just going to be the steps of composite filling and an amalgam filling. I've gotten a few comments asking me if I can just explain what in order you hand the dentist during these procedures. So again, like I say in all my videos, every dentist is different, but this is a pretty basic composite filling, just what a dentist may use, and then amalgam, just the instruments or tools that you may be handing your dentist. But all dentists are a little bit different. Some may have different tools, but I do feel that the dentist I work with is pretty basic, which is a good thing. I love it. It makes my job easier. So on the dentist side, he likes to have a mirror. This one's a little dirty, sorry, I've had it for a long time. An Explorer. And this is actually called a pigtail Explorer, but some of them are straight on the ends, but it's an Explorer, and then a pair of cotton pliers. So that goes on the dentist side for composite filling. Now, he's also going to have a high-speed handpiece, a slow speed, and then his burrs that he likes to use, which again are going to be different for all doctors. I always put some gauze over there for the dentist, and then my dentist likes cotton rolls, but you may also put like a dry angle if you're doing a back molar, just to make it a little bit easier to keep the moisture off that tooth. So that's on his side. So first, of course, he'll get the patient numb, and then when you're ready to start the procedure, you of course are going to be suctioning as the dentist removes any decay from the tooth. And then when he tells you that he's ready for the composite filling, after you put the matrix on, so again, for certain dentists, it's going to be different. An interior tooth, you're going to use a Mylar strip, which is a clear piece of plastic, and with a wedge, they're going to secure that on the tooth. Now, that's only if there's a contact on the tooth, so if it's mesial or distal, because you got to make sure that, of course, the composite material doesn't fill in between the teeth, because then the patient's not going to be able to floss, and you don't want that. So you need a matrix. If it's a back tooth, some doctors use just a regular matrix, which I think I have one. Yes. They'll use just a regular matrix for composite, or there's also a system called the T3 system, which is some rings. So let's just pretend he's put the matrix on and he's ready to start with the composite filling. The first step in a composite filling is etch. So there usually is a tip on here, but I took it off so I don't get poked. But this prepares the tooth for the filling. So you're gonna hand that to him. I usually hand mine like so he can grab onto this. Okay, you don't wanna hand it to him like this because he needs you to hand him the handle. So the etch is gonna be first. Now the etch needs to sit on there for about 20 seconds. Some dentists leave it on for 10, 15. Again, every dentist is different, but 20 seconds is a good time range. And then you're gonna use your high-speed suction, and he's gonna rinse off the etch. And then the next step is going to be bond. So this makes the composite stick to the tooth. There's all different kinds of bond. This is what we use. There's this little bottle here, and then there's a little Dappen dish. So you put it in here. And also bond, this is light curable. So I always put a little 2x2 on here if I'm not using it, because if you leave it out, it will dry up. It cures it, the light does. So then, once you fill up your little Dappen dish, I always hand it to my doctor like this with the little micro brush in the hole that has the bond. And then he grabs this like so. He might dap it a few more times, and then he's gonna put it on the tooth or on the part that's getting the filling. And then some doctors like to spray a little air after they applied the bond, some don't, but you're gonna apply the bond, the dentist is, and then you're going to light cure it. All right, so then you cure it, the dental assistant does. You cure the bond, it takes 10 seconds, and then he's ready for the composite. So this is a composite gun. There are different shades of composite, so you need to make sure that you grab the right shade. They are labeled right here if you can't see that. This is A1, this is a very light shade. So you wanna make sure that you grab the correct shade. and then I hand it to my doctor like this. So again, he can grab the handle. And then of course you want to remove the cap so he can use the composite. And then after you hand him the composite, depending on what instrument your doctor uses, if my doctor is doing an anterior composite, a front tooth, he will want this guy here. And this guy here is called a Greg. It's smooth here on the ends, so he can kind of apply that composite there on the facial if he needs to. Or if he's doing a posterior, he wants the ball burnisher, so he can pack that in there. So once he has that in there, you're gonna cure it. So again, you're going to cure the composite in there. And if it's a large filling, they may do a couple of layers of composite. So you may have to give this back to him so he can squirt some more composite in there, and then give him his tool of choice so he can, you know, push it in there. And then you're gonna have to cure it again at the end. And you cure composite for 20 seconds. That should be your setting on your curing light, so 20 seconds. And then when that's done, he will remove the matrix that he placed on the tooth. And then he will shape the tooth with his burrs. So you put your suction back in there. And then you're gonna wanna give the dentist floss. This is how I always roll up my floss, like this. And then I always pass the floss like this to my dentist, and then he grabs it. And then if you ever wanna roll your floss like that, I just think it's easier to keep track of. If I just put this big blob on my tray, I'm gonna lose it. I just use my 2 fingers like this, and I just wrap it around, and then I grasp it right here and I pull it off, and then you have a nice little ring of floss. And then you can just grab the 2 ends like so, and then you just pull, and like that. So that's how I hand my floss to my dentist. He's gonna floss to make sure you can get the floss in between and that the contact is tight. And then you are gonna hand him this guy. So this is your bite paper. So basically you're gonna hand it to the dentist. Again, you wanna hand him the handle part of it. And the patient is gonna bite on this occlusal paper, and it's gonna mark any high spots of the filling in blue. And then he can do his adjustments if needed. So yeah, that's a composite filling. That's very basic. Some dentists will use a little bit more, but that's the basics of a composite filling. And honestly, it's fairly easy. But yeah, moving on to amalgam fillings, because you do need a little bit of different things for that. So amalgam fillings or silver fillings, I know there's a debate. Some offices still do these, some offices don't. Some people think it's bad for you. My office still does them, and a lot of offices still do them. So you may be assisting during an amalgam filling. So it is a little bit different than a composite. A composite filling, you need bond and etch. An amalgam filling, you just need the amalgam. So again, we already discussed what's gonna be on the dentist side, same exact thing. So of course you're gonna grab your suction, and he's gonna remove the decay from the tooth. Now the first thing he's going to do is he's gonna use this matrix here. This is used on every amalgam filling that is mesial or distal, you know, that has a contact. If it's just an occlusal, you're not gonna need a matrix. But anything that's going, if there's not anything to pack the amalgam in, so if there's like a mesial or distal decay, you're going to need a matrix, so you can pack the amalgam in, if that makes sense. And I do have a video called Mastering the Matrix, I believe, which is so funny to me because a lot of people thought that was about the movie The Matrix, but it actually was about this guy here. But I do have a video if you need help setting these up. But yes, before you start your filling with your dentist, you want to make sure this is set up properly. So I'm gonna set this up here. But if you need to know how, I do a video again called Mastering the Matrix. And a trick for these guys too, if you can see this, beforehand, once I set it up, I always use an instrument to kind of round it out. It makes it easier for you if you're placing them, or the dentist to place them on the tooth. So nice and rounded, makes it a little bit easier. All right, so yes, this is the first thing you're gonna hand the dentist. So you hand it again, handle first. You don't wanna hand it this way. You wanna hand it with the handle, because that's what they're gonna be grabbing. He's gonna place it, and then he's probably gonna ask for a wedge. which my office uses little wooden wedges, which I don't really have, but you want to hand him a wedge. And then I always hand my dentist the ball burnisher. So this guy here, after he's placed the matrix, because they will put that in there and kind of shape the contacts and make sure that the contact is there properly and that's, you know, on the gum line, so the material's going to the gum line. So they'll kind of use this to shape the matrix a little bit, so I always hand them this. And then we're gonna get into the filling. So they're ready for the amalgam. So you grab the amalgam, you put in your amalgamator, which is this little machine that shakes up the amalgam and activates it. Usually the machine takes about 8 seconds. Take out your amalgam. I don't have one, but you put your amalgam into a little dish, and then you use this guy here. And you always put your finger underneath here, and then you pack the amalgam in here. Now you do both sides, and it packs in there very, very well. You pack it in, and then you hand it to your dentist like so. I kind of hand this way because that's how he grabs, but yeah. And sometimes your dentist will say large end first or small end first. You can kind of think in your mind too, if it's a large filling, I'm gonna hand him the large end. So I will hold the small end and hand him the large end because he's gonna need more amalgam. And then if it's a small filling, I'll hold the large end, hand him the small end. But I always fill both sides. You know, unless your dentist doesn't like that, but I'm sure he'll tell you, but I always fill both sides. So here you will, you know, push this and push it into the hole in the tooth or the filling site. And then you're gonna wanna hand him a packer. So this is a packer here, or a condenser, some people call it. This condenses the amalgam or packs it in. So he will use that to push the amalgam into the site. And then you'll go back to handing him more amalgam if he needs it. So let's say he's like, okay, that's enough. The next instrument my dentist likes is this football burnisher. So he uses this to kind of smooth and push in the amalgam some more. Some dentists will use the ball burnisher, but my dentist likes this, so he uses this to kind of smooth and push in. You want to make sure you have your suction in there to catch any excess amalgam that may fall. Your large suction. So you're doing that. And then I hand him the carver. So the carver, again, is going to be scraping the excess amalgam. So again, your suction needs to be in there because you need to be catching the amalgam. You don't want the patient to be swallowing the amalgam. So he's going to be scraping. And then I will hand him floss so he can check the contacts. If there's not a contact, we go directly to the occlusal paper. Then the patient's going to bite on the occlusal paper. And while he's doing that, in my hand, I have the carver ready to go because if it's high, he's gonna need to carve away some more amalgam. So let's say the filling's high. So I give him back the carver so he can carve the amalgam out. And then I give him back the paper so we can check it. And then he's like, all right, looks good. Well, then I give him the ball burnisher because it kind of burnishes the filling. It polishes a little bit and then it just smooths it out. So he'll smooth the filling with the ball burnisher. And then that's it. That's the amalgam filling. Again, pretty easy. And again, all dentists are gonna be different. Now, composite sets up right away. So we always tell patients you can eat and drink like normal. You're gonna be a little bit numb for a couple hours, but you can eat and drink normal food. With amalgam, it takes 24 hours to fully harden. So you have to inform the patient just to be careful with eating on that side, to avoid that side for the next 24 hours. Definitely nothing crunchy like nuts or things like that because it can break the filling because the filling is soft for the first 24 hours. But yeah, so those are the steps in the composite fillings and the amalgam fillings. Those are the two most common basic fillings that you're going to be doing. There are some other ones with different materials, but that's the most basic ones. So yeah, I hope you guys found this video helpful and I'll see you in the next one. Bye guys.